What is atrial fibrillation? Atrial fibrillation is an irregular heartbeat that affects the small chambers of the heart, the left and the right atrium. These chambers in atrial fibrillation wriggle. Now initially, atrial fibrillation just can come on suddenly. You feel funny palpitations, you feel your heartbeat, it might be racing, you might feel dizzy, it might take your breath away, and it's really quite scary. And what happens is, instead of your atria beating like this, they suddenly start beating like this. Now, just as a point, atrial fibrillation is very different to ventricular fibrillation. Ventricular fibrillation is when the ventricles, the big chambers of the heart, fibrillate. Ventricular fibrillation is a deadly rhythm, and if you were in ventricular fibrillation, you would collapse. Atrial fibrillation doesn't make you collapse, but it does make you feel unwell. Now, over time, the atrial fibrillation, instead of being on and off, it starts to become more persistent, and then eventually it becomes permanent. Now, the big problem with atrial fibrillation is this. Firstly, it makes you feel really bad. When it becomes permanent, sometimes patients just forget that they've got it. But what's really happened there is that they've become accustomed to the atrial fibrillation, and although they don't know it, their heart function is reduced by up to 30% because of the loss of that regular contractility of the atrial chambers. Now, the other big risk with atrial fibrillation is stroke. Whether you're on and off, paroxysmal, or it's persistent, that a bit of medicine can sometimes get it out of atrial fibrillation, or it's permanent, you will need a blood thinner, because without that blood thinner you run the risk of having a stroke. Now, most of the time atrial fibrillation is treated with medicines and blood thinners, but if we get atrial fibrillation early, in some patients we can eradicate it completely, and this can be done by keyhole treatment, either through the groin or by a combination of surgery through keyholes as well as treatment through a wire in the groin. We call this convergent atrial fibrillation treatment. We're very, very good at this these days, and in the right patients, we can get a really good outcome. So if you are wondering about learning more about atrial fibrillation, go to the website. There's some nice information there. There's a nice PDF that you can download for free. There are some videos on the YouTube page. If you want to get in touch with us, give us a call and we'll see what we can do for you. Subscribe to the channel because we're going to put a lot more information out about atrial fibrillation.